Well, in a very unique set of circumstances, politicians, doctors, judges, and major community stakeholders are coming together for one cause: improving mental and behavioral health resources here in Idaho. Now, the group Mental Health America ranks Idaho 50th in 2021 in the country when it comes to overall mental health access and resources. So very literally almost last. If you look back historically, Idaho on a lot of metrics sits near the bottom of the pack in this category of mental health evaluations. So is something going to be done, or is this just the way it is in the Gem State? Well, good news for those of you who are hoping it's option A, doing something about it. Major players from all across Idaho are working to find solutions, and now they have the blessing from Idaho Governor Brad Little to the tune of millions and millions of dollars. Major stakeholders in all branches of Idaho government are celebrating a new multi-year investment into behavioral and mental health to the tune of $66 million. The hope is that major investments into targeted areas of need will transform Idaho's approach and resources.
It is a lot of money. It's probably the largest one-time infusion of funds that we've had in my tenure in working at the department.
Ross Edmonds is the administrator of behavioral health at the Idaho Department of Health and Welfare. Edmonds says the news of major investments into behavioral health is the result of years of preparing.
Yeah, there was. I think what we recognized is that behavioral health doesn't just belong to any one organization or entity. It affects all of us. It affects people involved in the court system, people involved in corrections, people that aren't involved in court system or corrections at all. And so sort of adding all that together, what we realized is that we should create this cross-sectional council. And so we call it the three branch solution. So it's all three branches of government came together and created the Idaho Behavioral Health Council to study the system and then make recommendations on how best to move behavioral health forward in the state.
What challenges is Idaho facing right now in terms of behavioral health infrastructure?
Well, there's probably a few I would point out. First and foremost, number one is workforce. Workforce is a huge challenge for us right now, just finding enough people that are wanting to work in the field generally, not even just in specific areas within the field, but just generally working in behavioral health is a real challenge. The other part is the rural nature of Idaho, trying to find some mechanism to get people the services in their own communities and not have to force them to travel hours and hours or move to be able to get the services they need. It's not realistic for us to put every kind of service into every community. We're not going to get a psychiatric hospital in every community around the state. But how can we find resources as close to people's homes as we possibly can?
A major catalyst for the investments is the Idaho Behavioral Health Council, a group made up of doctors, lawmakers, judges, topic experts, and health administrators. The council worked for years to study areas of need and identify solutions that investments could address. Idaho Representative Brooke Green is on the council and has worked with it since the beginning.
When we first started meeting, it was kind of who are the players at the table, right? So the interesting part about it is it includes, not only does it include legislators, but it also has practitioners on board, educational, representatives on board. You've got the judicial, and it was kind of getting in the room together and recognizing as we move forward together, what does that look like? And initially it was, what is our strategic plan? How can we be impactful in Idaho? And it's getting all these phenomenal minds and leaders in the community to get together and actually think through that process.
It seems that when you have scenarios like this, one of the most impressive things is that you got everybody at the table together to talk about this. I mean, how crucial is that just to get everyone on the same page?
It was incredibly crucial. It was incredibly important in addition that all three branches bought into this. And the resolution made that happen, putting it in legislation made it happen, but also following it up with actual funding makes it a little bit more real. We are actually talking policy and then we're implementing that.
It's a huge statement. I think that we've been building for this for some time. We really, over the past decade, have been adding components to the system. Crisis centers. We've talked a lot about crisis centers, recovery centers. We've been adding components to the system. I think the beauty of what the Behavioral Health Council is doing and these investments, it's to take all of those component pieces and to put them together in a single model. It's to really build a system as opposed to segments of a system that are sort of free functioning, and bringing all that together in a really systemic way is probably the best thing that we can do.
What investments or targeted allocations were you most excited about?
Well, I would say the youth programs, because in Idaho we have a huge gap of providing for some of our most vulnerable children, and it's because we don't have facilities to treat them. We don't have the ability to put them either in long-term residential treatment, oftentimes actually shipping them out of state. And I had heard from a lot of parents who are like, I'm incredibly concerned, while my child is 14, 15, they're exhibiting these behaviors, what resources are available? And we rely on like Medicaid to get them the resources. The reality is we need to provide a more robust residential treatment facilities, more diversion opportunities. That to me is really our commitment, because if we can address issues while they're young, the opportunity to put them on a path to success is incredibly important.
Curious for your opinion on this, because as an outsider, it would seem to me the last few years there's really been an emphasis on mental health, behavioral health. With COVID and the pandemic, I think very clearly the community saw the impacts of that. That's my view as an outsider. I'm curious, is that the reality here on the inside, that COVID really drew attention to mental health and behavioral health and maybe drew attention for more investments?
I think so. We've definitely recognized that through COVID, the isolation involved in that, it exacerbated some people's anxiety, some depression, and that sort of stuff. I don't know that COVID, from my perspective, necessarily created a more a robust public recognition of it. I think that's kind of generational. Honestly, it's for some time now we've recognized that kids today are much more open to talking about their anxiety or their depression than generations in the past. The kind of historical mentality of, look, pick yourself up by your bootstraps. That's a weakness to say that you need help. I think we're moving away from that. I think we're moving to a place now where people recognize that mental illness is an illness like any other. It's a chronic health condition.
And there is a lot more to dive into on this topic and the plan the state of Idaho has. And our partner, Betsy Russell, over at the Idaho-Press, did a fantastic deep dive into the new investments and programs that the $66 million will help with over the next 3 years. You can find her write-up and more details about this program and what the state of Idaho is doing on the mental health front right now. Our website, ktvb.com.